Hello, I'm Dr. Paul Roach. I'm a board-certified orthopedic surgeon, and I'm a shoulder specialist. And I take care of a large number of patients who are injured on the job. Today we're going to talk about shoulder care for injured workers. And I think the most important thing that I can emphasize about their care is an early detection of their injury. I cannot emphasize enough how many times I have seen patients who have gone through many treatments only to find out that they had a treatable shoulder problem, and then they were sent to me and well treated. And in order to help you to know which patients need to come see me, I'm going to discuss with you briefly what I've asked my primary care doctors to do when they're assessing shoulder patients. The first thing is we have to be on the lookout for red flag events. Red flag events are shoulder dislocations, fractures, or nerve injuries which may show up as numbness of the arm. In those cases, if there's any dysfunction of the shoulder on exam, specifically if they can't elevate their arm, those patients need to be sent to me immediately for evaluation. Do not start them on treatment. The second thing are patients who have had shoulder pain, which can be pain in the shoulder blade, pain in the neck, pain in the shoulder, pain that goes down the arm, pain that interrupts their sleep, difficulty or weakness moving their arm. If they have an exam positive, and here's a few of the exams that I would like to see documented, and you should look for in your reports as well. So for motion, we're looking for abduction, internal rotation to the back, also known as IRB. For strength, we're looking for Jobe Supraspinatus testing, also known as JST. And certainly the one that we're all familiar with are the impingement signs. And the most important of these are the near impingement signs. These give us information about the function of the shoulder. Now, a patient who does not have a red flag, who has a positive history and a positive exam and has been treated for 6 weeks, but is not progressing, this is a patient that should be sent to me for an evaluation. They may need an injection in the subacromial space or the glenohumeral joint to treat their inflammation. And as you know, these injections are of vital importance for making decisions about patients who need surgery and patients who don't need surgery. So if your patient is not progressing at 6 weeks, I would look on your reports to see that the primary care doctor has documented this history and documented any of these findings. And if they have not, they need to. If they have documented these findings and they're positive, this patient should be sent to me for an evaluation so that we can sort out the cause of their shoulder pain and move them along so that they can get back to work as soon as possible.